In this video, we'll take a look at how we can work on cross-sectional slices of 3D data here in Romexis software. So, as always, when we open the volume, we first get here in the Explorer submodule, and then in order to find the cross-sectional slices, we would go here to Implant submodule, or then, depending on the license with which we are using Romexis, we might have here cross-sections instead of implants. So let's click on that. In this submodule, we have this kind of selection of views. We have the axial view, a panoramic view, and then the cross-sectional slices here. And then we also have the 3D rendered view, like always. We could change the relative sizes of these slice views by grabbing on this icon that has 3 lines on it. Also here, we can find that. Or then, for example, in order to maximize these cross-sectional slices here, on the bottom of the screen, we could use these small arrows next to the view and hide completely the 3D rendered view. Let's then take a closer look at these cross-sectional slices. So like we see here on the axial view as well as the panoramic view, these cross-sectional slices are perpendicular to the panoramic curve that we have created. And for making this panoramic curve and the view respectively, we can use these panoramic tools here in the toolbar. There's a separate tutorial about using these panoramic tools, so you can take a look at that when needed. When we go to these cross-sectional slices here, we can see that the respective line gets highlighted on the axial view and the panoramic view, so we can recognize which slice is which. Also, we can check the number here on the corner and see the same number next to the line. You can move the cross-sectional slices along the panoramic curve by grabbing the slider on top of the cross-sectional views. So like we can see on the axial view, the cross-sectional slices are moving along the dental arch. We can adjust these cross-sectional slices by opening these viewport settings here in the corner, so this small wrench-like icon. So here, firstly, we could determine how many slices we have visible at the same time. So we can just hover our mouse on top of this grid, and when we have selected the desired number of slices, we can click with our mouse, and we get that number displayed here in this view. Furthermore, when we go back here, we can also adjust the distance between 2 adjacent slices here. So this is the first slider here. Like we see, the cross sections get further away from each other. With this middle slider, we can change the width of the cross sections. Like we see on the axial view, the width gets modified. And then finally, the last of these sliders adjusts the thickness of each individual slice. I'll change this back to 5 slices like this. When we have this zoom tool activated here, we can zoom in and out these slice views by using our mouse wheel like always. And then if we would like to zoom all of the slices at the same time, we could keep Control down on the keyboard and use the mouse wheel in order to apply the zooming on all slices in the view. If we would like to modify the range of data that is displayed here on the slice views, we could open here this Define Data Range tool, and we could restrict with these sliders which part of the cross-sectional slices is visible. Let's then take a look at these further settings here next to the cross-sectional view. So we have a little bit different selection of tools here compared with other views here in the 3D module. Firstly, we have here the full arch mode. By clicking on that, we get cross-sections along the whole dental arch, and the distance between 2 adjacent slices is always the same. This would allow us, for example, to make measurements on each slice, and we would always easily find those measurements by browsing through the slices. Furthermore, we have then mirroring of data, like always. And in addition to this, we have also this other mirroring mode that mirrors the slices according to this apical point of the panoramic curve. So when we move our cross sections over this point here, we can see that the slices on the other side of this point have a different orientation than the slices on the other side. The implant-centric view here is presented in the tutorials concerning implant planning and positioning. These were the viewport settings, and then we have here also the snapshot function, so we could make a 2D image of this view that would be saved among the 2D images of the patient. And then we could maximize these cross-sections on the whole image viewing area. Finally, let's take a look at how we can modify how these slice views look like. So we could go here to default settings, this big wrench-like icon here, and here we could determine the visibility of these cross-section lines here, or secondary cross-section lines. And we could also, for example, change the numbering of these slices from ordinal labels to panorama reference labels instead.